Welcome. I'm Bill Osmunson, dentist, 46 years of practice, along with masters in public health. For about the first quarter century of my practice, I promoted fluoridation. Many have asked what changed my mind, and I'm opposed to it now. Number one, freedom changed my mind. I believe in freedom. I believe we should give freedom to people as much as possible. As long as they're not hurting someone else, they should be given freedom. Every time I've spoken in a meeting where there have been the fluoridation lobby promoters, they've all agreed with me. We should give people freedom. There are other sources of fluoride. If you want to swallow fluoride, then just use some of the other sources. But give us freedom. Fundamental promise we must make to our people is that the food they eat and the water they drink are safe. I'm going to go pretty fast over these slides. Anytime, just stop things and look at the graphs more, study them more, do whatever you want. But I'm covering several streams of evidence and want to have everything here to give you the first basics understanding. And science changed my mind. A summary. The FDA warning Food and Drug Administration, do not swallow. Fluoride is a drug. Topical is approved. Ingested is not. Fluoridation would be banned if approval is attempted, is what they told the Washington State Board of Health. The EPA scientists say it's highly toxic, not significantly effective, and borders on criminal behavior on governments. It's a contaminant. There's no uncertainty factor or interspecies variation. They have a 1-to-1. The National Toxicology Program. Fluoride is a developmental neurotoxin. Most developed countries say no fluoridation. Fluoridation is not cost effective if harm or quality science is considered, if there is a benefit at all. 6, fluoridation does not have significant benefit. No known mechanism. There's no way for the fluoride to get from the center of the tooth, the pulp chamber, on through the tooth to the outside of the tooth where the decay is forming or dissolving the tooth. There are no randomized controlled trials. Dosage is too much, even without community water fluoridation, because 2 out of 3 children show signs of too much fluoride. My biggest concern are infants. Mother's milk contains almost no detectable fluoride, about 175 times less fluoride in mother's milk of those mothers that they could detect the fluoride in. Do not use this fluoridated water for baby formulas, or mothers who are breastfeeding, or during pregnancy, or women who are wanting to become pregnant someday. The American Academy of Pediatrics historically said no prescription fluoride under 6 months, in other words, no fluoridated water, and only 1 cup until 3 years of age. That's not very much. What is water fluoridation? It's the addition of fluoride to 0.7 parts per million or milligrams per liter, same thing, in water. A flawed attempt to mitigate the harm to the teeth from sugar. Historically, the sugar industry knew that they were causing, their product was causing tooth decay. So they wanted to find something that would help reduce tooth decay, and people were saying that fluoride would reduce that. So the sugar lobby put in a whole bunch of money to market this idea of fluoridation. They were the same marketing people who marketed the safety of tobacco. Not so terribly much safety, but uncertainty of risk. Always uncertainty. Hexafluorosilicic acid is the most common form of fluoride used. A bunch of it's coming from China. It's not, all of the stuff they put in the water is not pharmaceutical grade. In other words, it's contaminated. The EPA has no empirical scientific data on the effects of fluorosilicic acid or sodium silicofluoride on health and behavior. In other words, they don't know if it's good or bad. That's not their job. In fact, they're prohibited from Congress from even adding the fluoride to water. They'll help those who do it, but they're not responsible. There's the state of Washington Department of Health, and no, the Board of Health says the same thing. We don't fluoridate. We let those who want to fluoridate do it. That's up to you. So it's the local authorities that are the doctors of this product. Industrial grade hydrohexafluorosilicic acid contains, well, you can read it. There's a whole bunch of contaminants in it. It's not a pure product. So it's not just fluoride that you're adding to water. There's a bunch of other things, and you can read that. Lead blood levels are actually higher in those who are on fluoridated water. And here's some research on that. Especially blacks and Hispanics have more problems. Washington State Board of Health. Oh no, this is pharmacy. Sorry. Washington State Pharmacy. But the state defines a poison as any other substance besides arsenic and strychnine or cyanide designated by the State Board of Pharmacy, which, when introduced into the human body in quantities of 60 grains or less, causes violent sickness or death. Other states have the similar laws like this. 60 grains is 3,889 milligrams. So when I went to the Board of Pharmacy and said, is fluoride a poison? Because, I mean, it is, but it needs to be designated by the Board of Pharmacy. And they didn't want to respond, of course, at first. But then they finally did respond, and they said, it's a prescription drug. Why? Because, well, 15 milligrams will likely cause death in a child. Is 15 less than 3,889? That's what I said to the Board of Pharmacy. Tell me, which is less? If it's less, then it's a poison. 5 milligrams per kilogram in adult. Let's say a 100 kilogram man, 220 pound man, that's 50 milligrams. Still less than 3,889. Is it a poison? And they said it is a prescription drug. Because poisons are exempt from poison laws when regulated as drugs. Okay, so if it's approved, if it's in a prescription, if the doctor's writing the prescription, then we're good. Okay, and that's where you can get fluoride, is from a doctor's prescription. Hang on a second. Who's the doctor adding fluoride to water? And anyone raise their hand? No. There's no doctor prescribing it. No doctor would prescribe it to all these patients who are not patients of record. The Food and Drug Administration, FDA, fluoride ingestion is not FDA approved. Topical is approved. Congress defined drugs as articles intended for use in the prevention of disease. The FDA goes into more detail, saying even on the internet, if it's well commonly known to help prevent a certain disease or treat a certain disease, it is a drug and needs approval. Intent of use determines regulatory oversight. The FDA testified to Congress that fluoride is a drug. Quote, from the EPA, the FDA remains responsible for regulating the addition of drugs to the water supply for health care purposes. The intent of use. When I asked the FDA, is it approved? They sent to me in an email, no. Freedom of Information request, they said, no, it's not approved. In court, even in emergency conditions of war, the government cannot force an individual to be medicated with a substance which has not been specifically approved for the purpose and manner it is intended. Okay, we're not at war. It's not an approved drug. Dental caries is not highly contagious or highly lethal. There have been occasional where an infection can go into the brain, but that's very, very rare. Manufacturers of unapproved drugs, according to the FDA and Washington State Board of Pharmacy newsletter, are usually they're usually fully aware that their drugs are marketed illegally, yet they continue to circumvent the law and put consumers' health at risk. To gain approval, the FDA asks, is it effective? And they're not going to approve a drug if it's not effective. They want to know, is it effective? They don't do a lot of the testing. They allow the manufacturers to do the testing. And at what dosage? How much does it take to be effective? And what are the risks for the different ages and different health and everything, and you see on television the advertisements for pharmaceuticals all the time, and they have a whole list of problems with these beautiful sunsets and people having a wonderful time, and everybody's healthy and happy, but they're telling you about how terrible it could be for you. And what is that label? Now let's look at fluoridation. Is it effective? Well, no, we don't know. Um, Best evidence is that it probably isn't. At what dosage? Well, we're not really sure because concentration in water is not a dosage. People don't drink the same amount of water. What are the risks? Oh, it's safe. No risks at all, according to the fluoride promoters. But there is risks. There's no question. What is the label? There is no label. For efficacy, it's unknown. For safety, do not swallow, according to the FDA. And the FDA also said years ago, there is no substantial evidence of drug effectiveness as prescribed, recommended, or suggested in its labeling. Marketing is in violation of the new drug provisions of the Federal Food, Drug, and Cosmetic Act. They have therefore requested that marketing of these products be discontinued. And they weren't. There's no substantial difference between fluoride diluted by the patient or the fluoride diluted in public water. So one of the first things I did that changed my mind is I picked up my toothpaste that I handed out to every patient that walked in for a cleaning. And I said, well, what's the label say? I hadn't read the label for years. And so I read the label. And it says drug facts. Okay, we know it's a drug. Do not swallow. Well, that's pretty simple and clear. And it says a pea-size amount to avoid swallowing on children, pea-size. Well, that part on the toothbrush is the size of peas that I use to squeeze out all of the pea-size amounts and calculate how much fluoride is in that pea-size amount. And it was a quarter milligram. Well, actually, it's a quarter milligram that the FDA says, but that amount that I have there is half a milligram. In other words, that's twice as much toothpaste as what the FDA is recommending. They sometimes talk about a smear now, tiny amount. But that quarter milligram is basically the same as one 11-ounce glass of fluoridated water. Okay? So on the one hand, the FDA says, do not swallow. And on the other hand, the city authorities are saying, you must swallow. Well, if you want to buy bottled water and try to avoid it, just try to avoid it. You go to restaurants or you cook with it or those types of things, then you can't avoid it. And there's no label. You don't even know if it is fluoridated or not. Okay, before we get too much further, I want to talk about the different quality of research. And you dentists and physicians and pharmacologists and toxicologists and epidemiologists, you all have had this in your classes. Expert opinion, that's what I'm giving right now. Those of us who promote and disagree with fluoridation, we give expert opinion. Sometimes we'll use some case series or case reports of people, and that's a little better quality than just an opinion. But the best evidence we have is observational studies. That's fluoridation's best quality. Okay, but the FDA requires randomized controlled trials. We don't have any non-randomized controlled trials. We don't have any controlled trials. And we only have one randomized controlled trials of fluoride ingestion, and it found no statistical significant benefit. And there, of course, without more than one, we don't have any systematic reviews, so we're relying on observational studies, which is a lower quality of study. It's a little bit like saying, during the summer, more people drowned. Yes, we know that. And during the summer, more people eat watermelons. Yes, we know that. Yes. But are the two related? No. Just because two events happen, A and B, does not mean A and B are related. And that's the problem with observational studies. Okay, now the next thing is interest-specific variation. In other words, some people are different ages, different genders, different races, different diets. Some drink no water, tap water. Some drink, the mean or the average is 1 liter, just under 1 liter per day, according to the EPA. And some drink over 10. So we're looking at a big variation right there. Health status is not the same for everyone. Margin of error, uncertainty factors, medications, etc., etc. There's lots of different factors for why we humans are not all the same. We don't all wear the same size shoe. We don't all wear the same size of clothes. There is a difference, and we call that a factor of 10. But then there's another factor that we need to include, the synergistic toxic effect. In other words, a very simple study years and years ago, and I don't remember the toxins, but we'll call them A and B. 300 mice taken, divided into 3 groups. Group A got toxin A until the first mouse died. And then group B got the second toxin until the first mouse died. They call that the L1 of both groups. They gave the L1 or lethal 1 dose to the third set of 100 mice, and my instructor said to me, "So Bill, how many of this in the third group, how many of those 100 died?" And my first gut reaction was, well, 1 plus 1 is really not difficult for me. 2, of course, died. And he said, no, 100 died. The synergistic effect, the effect of 2 different toxins is multiplied significantly. And we have thousands of toxins coming at us and new ones all the time. And so at least a factor of 10 should be used there. What does the EPA use? The EPA uses no safety factors, no interest-specific variation. It's all 1-to-1, so there's no protection. The EPA's level of concern is, this is another factor, that fluoridation is safe until you see severe skeletal fluorosis or severe dental fluorosis. It's safe. It's safe. And so what happens? Yes, 4 parts per million, we can start to get some cases of severe skeletal fluorosis. But when we study closer and we read the research closer, we find that there's lots of problems of skeletal fluorosis before it looks like that, and teeth before it gets like that. So let's look at some of the different observational evidence. Fluoridation does not improve dental health. One of the first things I did, because I didn't believe that it didn't work, I was convinced. I could see it in my patients. I mean, most dentists and physicians can. At least we think we see it. We give credit to the fluoride for people who have better teeth, and if they don't have good enough teeth, well, they're just not getting fluoridated water, are they? Oh, no. They're living out in the country, and they're poor, and they don't have any income. And so I graphed the 50 states here in this chart. And the blue line going on up from down to nothing, clear on up to the top, is every state's whole population fluoridated. Then I charted or plotted each state's very good high-income teeth of children reporting excellent to good teeth, and the pink one up at the top, and about 82% roughly, I think it is. And then those that are poor at about 55%. And all of a sudden, the light bulb struck in my head. Wow, there's a huge difference between the wealthy and the poor. If we just increase income, we'd probably do better than fluoridation. I mean, this shows a huge statistical difference. But whether you fluoridate at nothing or whether you fluoridate at 100% of the public in each state or in the United States, it doesn't change the good teeth of the wealthy or the good teeth of the poor. You got to think that through now, okay? That's very, very important. The FDA says fluoride ingestion effectiveness research is incomplete. Part of the reason that they say it's incomplete is there are no randomized controlled trials of fluoridation. Study limitations often include, and this could take days going over each one of these of why, but I'll go very fast. Not one study corrects for unknown confounding factors, and I'll show you that a little bit later. Not one prospective randomized controlled trial. We've already talked about that briefly. Socioeconomic status, often not controlled. If we're comparing the poor and the rich, like on the graph before, well, obviously we're going to see a big difference. Inadequate size of the study. Difficulty in consistently diagnosing early decay. That is huge. You know, when I was in school, we needed to see that decay on the x-ray into the dentin before we would do a filling. Now, my good buddies that are just out of school, if you can see the beginning of the decay, decalcification, that's when you do the filling. So not every dentist has the same opinion on diagnosing early decay. Delay in tooth eruption is not controlled. Diet is not controlled in many studies. Some they do. Total exposure of fluoride not determined. How much are you swallowing in toothpaste? How much are you swallowing in foods? The total exposure is not determined. Oral hygiene not determined. Not evaluating lifetime benefit. Estimating or assuming subject actually drinks the water. About half the water now is bottled water that is drunk in the United States. Dental fluorosis treatment expenses not considered. Mother's fluoride exposure, breastfeeding, infant formula excluded, fraud, gross errors, and bias not corrected. Genetics is not considered. There's too many problems here that this is why we need randomized controlled trials. And yes, there is one out east that has just started a randomized controlled trial, finally after 70 years of fluoridation. But my problem is they're not giving the cohorts informed consent properly. They're evading a lot of the risks and not telling them what the problems are. Okay, second stream of evidence, Environmental Protection Agency. That was the FDA, now we're looking at the EPA. Freedom to have safe water. The EPA scientists, these are the employees at the FDA, at the EPA. These are our servants. These are our lifers that are working there. This is through the union that they're speaking, and not the politicians. So the union people are saying, in summary, we hold that fluoridation is an unreasonable risk. That is, the toxicity of fluoride is so great. Well, yes, and the purported benefits associated with it are so small. And I remember reading that and going, what do you mean benefits are so small? If there are any at all. That requiring every man, woman, and child in America to ingest it borders on criminal behavior on the part of governments. Authorities, you, me, the authorities we're bordering on criminal behavior because we're giving it to them and it doesn't have benefit. It's just been marketing that has been done, and we thought it was beneficial. In 2006, the National Research Council report found the EPA maximum contaminant level for fluoride was not protective, 2006. And in the last 18 years, what's happened? They haven't changed it. They haven't done anything about it. Politically, they're having a terrible time trying to protect the public because of the politicians, not because of the civil servants. The primary endocrine effects of fluoride exposure in humans and animals include thyroid function decreased. Okay, obesity? Now hang on a second. Do we have an obesity problem in the United States? I need to read no further. Diabetes and impaired glucose. We have a terrible time of diabetes problems in the United States. Why in the world are we fluoridating, adding more? Early puberty onset. Now, the National Research Council had a whole bunch of things that they had concerns for. Tooth damage. Oh, yeah, I treated tooth damage. Made millions of dollars on selling fluoride topical applications and in treating both cosmetic and functional harm from too much fluoride. So I know that it causes tooth damage. Rheumatoid and osteoarthritic-like pain. So there's more than just severe skeletal fluorosis. There's rheumatoid and osteoarthritic-like pain. That's earlier stages than what the EPA uses. Bone cancer, yeah, and there is. And if you look at the cancer and really follow through with it, it is causing bone cancer, even though the fluoride lobby has tried to cover it up. Bone fractures, tooth fractures, thyroid reduction, diabetes, obesity, kidney damage, reproductive problems, lower IQ, developmental neurotoxicity, allergies, gastrointestinal disorders. This was back in 2006, and we're still adding fluoride to the water because the fluoridation lobby has doing their best to create doubt. They want to have absolute proof that it is causing any kind of harm. And when there is proof that it's causing harm, like dental fluorosis, then they minimize it and say, well, that's not really harm, that's not really damage. We'll get into that a little more later. Okay, estimated no effect levels. This was done in 2006 by one of the authors of the 2006 National Research Council report for the EPA. And you can see the red line there. The red line is the reference dose. That's where it's safe. In other words, you get more fluoride per milligram per kilogram per day, and you're going to have some problems. You get below that red line, and it's safe, according to the EPA. Really? Well, the problem is that, it isn't safe. And so what the EPA then did was not lower the red line to make it safe. What they did is they raised it from 0.06 to 0.08 milligrams per kilogram per day, saying, well, it's actually safer than we were saying before. In reality, we should be having the fluoride level down to about 0.004, like mother's milk, or even 0.02. We're seeing the research on developmental neurotoxicity doesn't seem like it's below 0.02. We're adding fluoride at 0.7. So we're way about 0.2 is, sorry, I got too many zeros in there. Let's start over again. 0.2 parts per million is what is probably safe, maybe 0.3. And we're doing 0.7 in the water. So we're doing about 3 times more fluoride in the water than what would be safe. Now let's look at another EPA report. The National Research Council said to the EPA, you need to do an exposure relative source contribution analysis. And in 2010, they published one. The blue lines indicate how much fluoride people are getting, okay? The black line is the increased safety, 0.08 milligrams per kilogram rather than 0.06. And so all the children, or the percentage of the children above the black line at those different ages at the bottom, are ingesting too much fluoride. 33% of the RFD was increased, and try to show fewer kids being harmed. Infants, notice, under 6 months of age, they're not included, which are at some of the highest risk. And also 10% drinking the most water are not included. And even then, this is what it showed of too much fluoride for too many. Third stream of evidence that we need to look at, the National Toxicology Program, NTP. Freedom from toxins. 2 decades ago, research reported lower IQ, increased mental retardation. 21% at 3.14 parts per million fluoride. Now that's a lot higher than 0.7, but it was 21% mental retardation. At 0.37 parts per million, it was 3.4% mental retardation. That was in 2000. So it was a concern that we were getting back 24 years ago. Let's look at what we mean by that. Let's get it into simple terms. If we had 260 million people, these graphs are from the Physicians for Social Responsibility in Portland, Oregon. They had it on their website. If we had 260 million people, the bell curve shows us that there'd be about 6 million mentally retarded, clinically diagnosed, that's the term used. scientifically, and 6 million gifted. So you have those at each end, the tails of the bell curve. If we have a 5-point decrease in mean IQ, the whole bell curve slides to the left, and we increase the mentally retarded by about 60%, and we decrease the gifted by about 60%. So what we end up with on the lower IQ is increased dropouts from school, increased unemployed, increased incarceration, increased divorce, increased special education, and a lot of other problems when you have lower IQ. And for the gifted, we have fewer inventors and decreased number of critical thinkers and artists and those excellence. So how do you measure the high IQ people? How do you know that? I can't find data on that. This is what we know scientifically, that when we lower IQ through the population, this is what we end up. We have a lot more data on the low IQ. So what I did is I go, well, is that true or is that not? I mean, we got to find out here. So I charted the 50 states and the mentally retarded and plotted those. Now you can see the pink goes up and down. Each state varies significantly. And it's federal data, but it's still a big difference. But there is roughly a doubling of mentally retardation when we increase fluoridation. So it's not proof, but it certainly is observational data. In 2015, I and others nominated fluoride to the National Toxicology Program, NTP, for developmental neurotoxicity review. I was told by the director a final report takes about 2 years. I thought, man, all these kids being harmed for 2 years, this is not right. Part of the report was published in August of 2024. The original NTP draft reported a presumed, now the final is a moderate, confidence neurodevelopmental hazard above 1.5 parts per million. Now, 9 years later, it took him to finally publish. Why? Well, it was basically the politicians blocked the civil servants' report, and the fluoridation lobby pressured the politicians to block it. It wasn't until we got the court to release that draft that it was actually released. And then they published the first part, okay? Not the whole thing, but the first part. Well, the second part basically is an addendum. The draft monograph was blocked from release by HHS politically appointed authorities until the court ordered release. The draft report has been divided into 2 sections. One called the State of the Science, which is basically the studies and how they rank the studies on quality. And the second is the meta-analysis, where they look at how much is it a problem. The reviewer is generally focused on clarity rather than disagreement on the conclusion. Here's a graph from the figure 17. It's a pooled dose-response association between fluoride in water and standardized mean differences in children's IQ. So if we look here at what would be about 0.7 parts per million of fluoride in water, or milligrams per liter in the water, that's fluoridation. That goes on over to about a quarter. And if we go to total fluoride intake, that goes over to about 0.4. And so immediately what happened is, like they've done on the previous studies where they use the standardized mean differences, they go, well, a quarter IQ and a half an IQ is really not much. I mean, that's hard to detect. Is it even statistically significant? What these fluoridation lobby guys and gals don't understand is that the standardized mean difference is 15 IQ points. So a half a standardized mean difference is about 7.5 IQ points. Fluoridation would be at about 4 to 5 IQ loss. And that's what the studies are showing. When you double that, which fluoridation water adds about 1/3 to 2/3 of total fluoride intake. So I just rounded off to about half is from water and half is from other sources as a rough consideration. That means that we're looking at closer to 5, 6 IQ loss with total fluoride intake. Some reviewers of the NTP report said that the monograph is not designed to be informative regarding decisions about fluoride concentrations for water fluoridation, unquote. The NTP scientists disagreed, confirming they were considering total exposure, not just fluoride from fluoridated water. Fluoridation is only one source of fluoride exposure rather than an individual's total dosage. In addition, water consumption is not controlled and averages about 1 liter per day. However, mean consumption can exceed 10 liters per day. So part of authorities need to decide here is how many people are we going to try to protect? Are we going to do the mean, right in the middle, those drinking 1 liter of water per day? But if you drink more than that, or if you're younger than that, or if you're not as healthy as that, we don't care about you. We're just going to do the mean. That's just not ethical, okay? It's not ethical. And the NTP scientists, in their judgment, used total fluoride. Now, they talked a lot about the water, and they used water for many different situations, but their judgment was based on total fluoride exposure. There are 9 mother-child neurotoxicity studies. These is considered some of the highest qualities, have been published. 8 reporting neurotoxicity at low concentrations. Now, that is a lot of studies just recently. There's one outlier, and that was in 2022, and it reported an increase of 15 IQ points for every 1 milligram per gram increase in mother's urinary fluid creatinine for boys, but not girls. That's an impossible boost to IQ that has never been found for any other chemical, nutrient, diet, or study. I mean, just think about what would you do to be able to feed your child a nutrient or a diet or chemical that increased their brain levels by 15 IQs. Even more impossible is the finding that the non-fluoridated zone, where the water fluoride concentration was way, way, way low, 0.05 milligrams per liter, the increase in IQ for those in the low fluoride communities, this is the low fluoride communities, was 28 plus IQ points. And when corrected for creatinine, increased to an impossible 38 point IQ increase for boys. If true, most boys would be gifted geniuses, and fluoridated communities would have few, if any, boys in special education classes. Of the 72 studies used by the NTP, and they reviewed over 500, to make their judgment, no other studies showed an IQ increase. Some showed no benefit, no loss, but this is the only one that showed an increase. Experts suggest the laboratory work should be redone. However, the fluoridation lobby only looks at the abstract, and with bias relies on one study to raise doubt of harm. Subsequent to the NTP cutoff date, research has remained reasonably consistent. A, quote, 0.5 milligram increase in fluoride intake from infant formula corresponded to an 8.8 IQ decrement in performance IQ and a 4.4 full-scale IQ point loss among preschool children who were formula fed in the first 6 months of life for each 0.5 milligram per liter increase in water fluoride concentrations. This would be a lot for infant formula, okay? And it's pretty consistent with all the other studies at full-scale IQ. One thing that is really interesting here is that they separated out performance IQ. And once you see that performance IQ is hit twice as hard as full scale, maybe there are sections of our IQ that are not harmed and sections of our IQ that are seriously harmed. So we're learning more, and as research grows more and more, we'll get more detailed. Will it say that it's safe? No, we've got too many, hundreds of studies that showing that it's not safe. But so it's not going to reverse this data. What it's going to do is help us find out more what type of IQ is being harmed. What I did, because IQ wouldn't be the only thing harmed on a developing brain, I took 12 countries and compared them based on the CIA.gov data. And I found that in the fluoridated countries, I compared them based on socioeconomics, so that they were similar. Similar fluoridated countries, 6 of them, had a 6.45 miscarriage rate per 1,000 live births. And in the United States, we're terrible on our miscarriages. And the unfluoridated were 4.47 miscarriages per 1,000 live births. We're going to get more data. This is preliminary, but I have no doubt that it's going to show more, that it causes miscarriage, premature birth, infant mortality, serious concerns. Number 4 stream of evidence. Most developed countries have freedom. Okay? I'm going to let you read this. These different countries, and you can find the evidence of what it talks about. They no longer or have never recommended fluoride supplements or fluoridation of public water. Most developed countries do not. Stream 5. Fluoridation is not cost effective if costs of treating harm are included. So they'll tell you, well, for every dollar spent on fluoridation, it saves $28 or whatever. They're changing that all the time, which they should, in dental expenses. Okay. What they're not telling you is that fluoridation causes too much fluoride ingestion and causes harm to the teeth. I treated dental fluorosis, and when you have the dental fluorosis treatment, you're going to end up with significant costs, far more than what you're going to get with benefit as far as costs in treating harm. The CDC says ingestion of fluoride is not likely to reduce tooth decay. At the same time, they're saying it. Another section, the CDC was saying it's one of the top 10 public health achievements of the 20th century. A systematic review shows the results show that the reviewed original studies on economic evaluation of caries prevention do not provide support for the economic value of caries prevention from fluoridation. So assuming fluoridation has benefit, the caries per person per year averted, less operational costs, is estimated at about $8 per person per year. Okay? If you take the cost to treat dental fluorosis, you're looking at about $126 per person per year. That's treating the damage. Not all of it is treated, but that's treating the damage if it were to be treated. In other words, if I took a key and I scratched your car, that's just cosmetic damage. Okay, your car's going to run just fine. Don't worry about it. I mean, it's not a problem, is it? I mean, I could scratch my initials in your car and it still wouldn't be a problem. It still drive just fine. But if you did that to my car, I would call it damage. Okay, I would say I want compensation for that. Now, if you said, okay, how much do you want? I'd say, okay, you need to give me, I don't know, let's say $3,000 for that scratch, because it's going to be hard to repair. I get the $3,000. Does that mean I'm going to go down and get it painted? Depends on the car, okay? But that doesn't mean it wasn't damage. It was damage. Okay, lower wages have 3 IQ points of about $500 per IQ point, ends up to be about $438 costs for lower wages from lower IQ. But hang on a second. It's probably more than that on the IQ, and there's more damage than just lower wages, but those are data that I could find easily. So we're looking at, a huge cost from fluoridation, more than benefit. The EPA research. This is something for the dentist to consider, because this is EPA research. A mean cost for all consultants shows that the estimated cost for restoring function exceeds the cosmetic costs in all categories except the minimum later costs. This represents a new finding and raises an issue that has been overlooked or ignored by previous investigators and the profession, that the repair of the cosmetic discoloration was the only cost involved, or that repair of dysfunction was never considered to be a problem. So the the dental lobby has said, it's just cosmetic, don't worry about it. I mean, we're placing black fillings in your mouth, so a little bit of white tooth in the front, that's no big deal, is it? And so don't worry about it. It's just a little cosmetic discoloration. But actually, repair of dysfunction is more than cosmetic damage. Very interesting. It never crossed my mind that some of the problems from the fluoride, this is electron microscope scanning, that the problems of the pits and the cracks and the fissures and the breaking of the teeth was more damage than the cosmetics. And so we look at a patient of mine with had infant fluoridated water to make infant formula, and you can see on the white at the tips of his teeth, on the cuspids there, and the pitting on the front teeth. And actually, if you look at the chewing edges, you can see that there's chipping on his front teeth. And this is considered a severe dental fluorosis for most of the teeth. Some of them are not so bad, but we don't show the back teeth here. Fluoridation lobby, the only known risk associated with the use of fluoride is mild enamel fluorosis, which is cosmetic effect with no known health consequences. But this kid, he now lives in Florida, was in New York when he got the fluoridated water. This is what we want to see in. We want to see healthy gums. We want to see a nice smooth enamel, nice clear, clean, gorgeous teeth. That's what we're looking for. That was a great smile, breastfed, no fluoridation, toothpaste not swallowed. Dental fluorosis. Now, this is Tony's handiwork here. Gorgeous, gorgeous dental treatment. We can see the white on the snow-capped teeth, and he did veneering of it. Normally cost about $12,000 and last about 10, 15 years. We hope longer. Sometimes it does, but a lot statistics don't show that it lasts as long as our hopes. Another thing I hadn't thought about was what's called the fluoride bomb. The tooth becomes very hard and brittle, and so we don't diagnose that decay as easily. And when we're looking at the decay, the difficulty in diagnosis of the decay, we say, well, we could clean that out and probably fix that up a little bit. Both teeth or one tooth? Well, maybe both, but it's really hard to detect there. And then we start cleaning it out. Oh, it's deeper and bigger than I expected. And wow, it's a huge cavity there on that back tooth, which we didn't see in the front tooth, except for those dentists who are really aware of those dark halos in there. And so we fix that on up. And yeah, the fluoride bomb, too much fluoride. None of that is included in cost estimates. Cusp fractures. This is just preliminary research. This is 3 different studies, which are difficult to compare, but 2 of them by the same author. And we see that when there's no fluoridation in the water, that we have about a little over 2% of the visits to the dental office are complete tooth fracture. But when 85% of the population in the community are fluoridated, we have closer to 7% are complete cusp fractures, visits for complete cusp fractures. Very interesting. We need more research on that. But we don't study our problems. We study our benefits. You don't sell anything. You don't make money finding out that what you're doing is harming people. And so we don't study our harm. 6th, this would be the number 6 on the stream of evidence. Fluoridation lacks significant benefit. And I've talked before about that. I brought stuff out before. 2024 Cochrane collaboration. This was presented at a conference recently. 21 highest quality studies reported reduced caries 4% in primary teeth and 3% in adult teeth. Very, very small benefit in that study. 2024 Lotus study. 6.4 million people in the UK reported caries at about 2% savings. No meaningful reduction in social inequalities. The risks not considered. 2009-2018 Iowa fluoride studies, NHS funded. When you see the funding of a study that is funded by the federal government, our taxes, you tend to have less bias. You tend to have a little more confidence in that kind of study. But there's no significant benefit. Now, what you may see from fluoridation people is that something like this with kids. And I weep when I see kids come in with problems like this. This is so sad. I mean, it just rips my heart out to see these poor kids. They don't know why this happened. Their parents haven't protected them, and they screamed and yelled if their parents tried. And so it was parents just giving in to their children, and that's terrible. Um, um, but let's look at this. The bottom teeth have no decay on all three teeth. The bottom, well, maybe a little bit on that far right one at the bottom along the gum line, but generally very little or no decay on any of the teeth on the bottom teeth. On the top teeth, severe decay. So does fluoridation only help bottom teeth and not top teeth? It makes no sense. When you see pictures like this, you can cry with the patient and cry with me, but fluoridation's not doing any good to these people. There isn't a simple pathway of fluoride from the bloodstream on through into the bottom teeth, but it avoids the top teeth. This is caused because of what's called early childhood caries, and is caused because of a bad diet, such as sleeping with bottled milk, juice, soda, something like that. When we compare World Health Organization fluoridated versus unfluoridated countries, we can see whether we add salt or not salt or whatever, decay rates have declined over the years. Very hard to study a moving target. Here's more current research, clearing up to about 2022. And we can see the non-fluoridated countries and the fluoridated countries. Actually, it's almost getting to the point where the fluoridated are getting more cavities than the unfluoridated. But that's not statistically different. But there hasn't been any real change. Was it fluoride or was it not fluoride? That's the problem. Here's older research, going clear back to the 1930s when my mom was born. And her generation, when she was 12 years old, had about 11 cavities per child. When fluoridation started, there were about 5 per child. This is one of the most important things for dentists and physicians to look at. What caused the decline in decay from before fluoridation started? Okay, what caused the decline in dental caries prior to fluoridation? We don't know. And so what we do is we just brush off that problem, right? Because we don't know. But we must understand that there was a huge factor in causing the decline and decay that we don't know about. And any research after fluoridation started, we have to control for that unknown that was huge. And we aren't. None of the studies are controlling for that. Was it socioeconomics? Maybe. Are we comparing rich and poor? Maybe. Was it some sort of a genetics thing, or was it other pesticides? Or we don't know what it was. But one thing for certain is it wasn't fluoride that caused a decline in dental caries prior to fluoridation. Counties in New York State, we don't see any benefit. Actually, we see a slight increase in decay with more fluoridation. CDC, ingestion of fluoride is not likely to reduce tooth decay. CDC, it is not CDC's task to determine what levels of fluoride in water are safe, but they sure do market it. Many have an excess fluoride in their serum. And yet, for those who like research, that's some interesting research, that it's very low. It's down close to mother's milk concentration, that's normal serum fluoride levels, but varies substantially. The CDC also said the laboratory and epidemiological research indicates that fluoride's predominant effect is post-eruptive and topical. And the concentration in the saliva, it can't get through to where the decays are developing, and then in the saliva, it's not likely to have any anti-cariogenic activity. Okay, number of recent cessation studies show that stopping fluoridation does literally nothing to increase overall dental decay. Modern studies find difficulty in measuring the benefits of fluoridation. Now, there's studies on both sides of this, but it's all observational data. The quality of the research is poor, And so we can't jump in and say, oh, well, your decay is going to go up in this area. It just can't say that if you stop fluoridation. The fluoride effect on dental decay is simply delayed due to a delay in the emergence of the tooth into the mouth. If the tooth is protected under the gums longer, it's going to be in the mouth a shorter amount of time and so have less decay. That may be one reason why it looks like there's a benefit. Our analysis shows no convincing effect of fluoride intake on caries development. Here's an interesting one for the non-dentists and the non-scientists. The ADA awarded Kentucky with 50-year award for 100% fluoridation in 2003. That's the same year that 42% were edentulous. In other words, they had no teeth. So they're awarded for so much fluoridation. Marketing was great, except for the fact that most of the people didn't have, they were number one in the United States for the most people without teeth. With 1.6 to 4 parts per million fluoride in the water, 50% or more past the age of 24 have false teeth because of fluoride damage. Fluoride causes tooth decay. Now, they say that's high on that water, right? Yes, that's high in the water. But we have so much more fluoride from other sources now. Keep in mind that 0.7 is equivalent to maybe anywhere from 0.7 or even less if a person doesn't drink water, drinks bottled water, clear on up to easily 7 parts per million or more. Kentucky, Detroit, Boston all reported a crisis of decay and all have had water fluoridation for many years. Since April of 1999, I have publicly decried the addition of fluoride, especially. This is a testimonial to drinking water for the purpose of preventing decay. Hardy Lineback. I'm quite convinced water fluoridation in the not too distant future will be consigned to medical history. Arvid Carlson, Nobel Prize winner. Fewer fillings had been required in the non-fluoridated part of my district than in the fluoridated. Fewer in the non than the fluoridated. 1997, John. Decay is not the result of fluoride deficiency. Brunel Carlos. The average difference in tooth decay, aged 5 to 17 years of age, was 0.6 of one tooth, and there's either 88 to 128 tooth surfaces in a mouth, depending on child or adult. 0.6 is statistically not significant. This is a graph from the CDC. So what are the proponents of fluoridation talking about? Well, you look at this graph, and up until when I graduated in 1977, we could see that the decay rate, DMFT, decayed missing filled teeth, was declining. Okay, yeah. And we could see that the percentage of people on drinking fluoridated water was increasing. Well, obviously, fluoridated water is decreasing decay, right? Well, of course, that's an obvious fact because A happened and B happened, and they've got to be related because we said so. Now this graph goes much longer than that, and we can see that there was a continuing increase in the percentage fluoridated, and there was a decrease in decayed missing filled teeth. So the CDC is saying, here's evidence that fluoridation is working, right? But let's look closer at the data. 40% fluoridated water goes on up to about 55% fluoridated water. So we have about 17% more people on fluoridated water. There was an increase. And decay went from about 80 or 4 decayed missing filled teeth down to about 1. About a 70% decrease. Now, randomly picking out of the United States 17% more people, if we picked out those with a high risk, we might get a logic in having a reduction in dental decay. But if you just randomly put it out in a few different cities, you're not going to have a 70% reduction in the entire nation. It's just statistically ridiculous to think about or to discuss or state. And I don't know why the CDC persists in putting out this garbage called science. Now let's look at Calgary and Edmonton. The fluoridation lobby convinced Calgary to start fluoridating again. Why? Because they said your dental decay rate is going up. Um, and we can see at that blue line where they looked at it and they said fluoridation ceased in Calgary, and the decay rate went up. So you stop fluoridation, you're going to have an increase in dental caries, right? Yeah, we've got it proved here that it's going up. And so even though the university said, whoa, hang on a second, this isn't quite true, the marketing by the fluoridation lobby was so strong that they introduced it again. If you extend those lines, we can see that Calgary, most of the increase in Calgary happened prior to fluoridation stopping. And Edmonton, that had fluoridation, was still increasing in dental caries. It wasn't fluoridation stopping that caused the majority of dental caries increase, if any. Number 7 stream of evidence, freedom to choose the amount of a drug. Okay, dosage is what we're talking about here. Many are ingesting too much fluoride. 0.7 parts per million in water is a concentration, not a dosage. A dosage is milligrams per kilogram per person. There's a huge increase in dental fluorosis, and I'm taking too much time here, so I'll go a little bit faster. We can see here that in 2000, 40% of the children had dental fluorosis. In 2012, 60% had dental fluorosis. Half as many children were unaffected by dental fluorosis at 12 years later. Another study here in Journal American Dental Association, permanent teeth in children. The blue lines are dental fluorosis. The more we increase the fluoride in the water, the more the dental fluorosis. Of course, we know that's true. The red lines are caries experience. And maybe there's a slight, non-statistically, slight decrease in dental caries from 0.3 to 1.2, but very slight, and that you got to include other sources of fluoride. So whether there's benefit or not is statistically difficult. I'm going to go very fast over this because this is something for you to look at and read. There's fluoride in many foods. Just don't eat, if you want fluoride, don't eat organic foods. Industry has a lot of fluoride. Drugs have a lot of fluoride. Anesthesia, vitamins, water, toothpaste. There's lots there. What they even did is they're starting to add perfume to foods so that it stops the mold and everything. Because we harvest the food in the fall and we eat it throughout the year. We don't want to have moldy food. So to preserve it, one of the things they're doing, they were using bromine, but that's causing greenhouse gases, and so now they're using fluoride. And the increase in foods of fluoride is huge, but fortunately it's not all the time. Here's some of the drugs that are there that have fluoride, and some of the problems from it, and some of the fruits and vegetables that can have a high degree of fluoride in them. Sugar, 13 milligrams per kilogram. And it's okay to have, according to the sugar industry, have a little fluoride here. It's going to help reduce tooth decay because if a little is good, more is better, right? Yep, on everything. Not true. I'm being sarcastic. Mechanically deboned meat. You're grinding up some of the bones in the meat. Here's a testimonial. I was fluoridated from conception in Grand Rapids, 1952. I suffered the irreversible effects of early fluoride hyperaccumulation as I was born both premature and fluoride formula fed. According to my medical history of intestinal malabsorption and chronic diarrhea, I am like 1% of the total population, allergic to fluoride. As a result of this early damage, my digestive system is permanently scarred and I cannot absorb nutrients and minerals as well. I am a shining example of fluoridation failure: bad teeth, bad bones, bad thyroid, bad kidneys, and breast cancer. My children, although breastfed for the first years of their lives, had late eruption, persistent deciduous teeth, dental fluorosis, and malocclusion, requiring extensive orthodontic work. The youngest girl is the most severely affected and also has malformed growth plates at ankles and knees. All three have suffered frequent joint stress injuries from normal school physical activities. Two have had fractures and chronic connective tissue problems. I simply do not understand how the ADA can deny the research that fluoridated children suffer more joint and bone injuries. And there are others that have autistic children, highly sensitive to chemicals, and they have a terrible time even taking a bath or a shower in fluoridated water. If the evidence provided so far is not adequate to convince you to provide freedom to your neighbors, the following studies are not up to date, and a new search can be done on pubmed.gov. All we ask is for you to give us freedom from too much fluoride. People can get fluoride from other sources if they want fluoride. It's not something magical to put fluoride in the water that you can't get the fluoride from something else. Give people freedom. I'm going to go over these slides, and you can stop it at each slide and look at the research if you want. I will not comment.